how can one distinguish between real problematic anxiety slash depression and the natural feelings of grief that come from a breakup?
That, again, is, I have to say, it's such a good question. For example, in the DSM, the Diagnostic and Statistics Manual, like where we classify psychological disorders and things like that, one of the clinical qualifiers for depression is that the symptoms were not brought on by a normal bereavement. And bereavement, of course, is what we experience when somebody dies. And when a relationship dies, a lot of times people do experience it as a death, and in a way it kind of is. So I would draw a parallel there. How do we know the difference between a true problem and, just an intense breakup? I would say, kind of the obvious ones to me would be, if you're ever thinking about hurting yourself or anyone else, that's obviously the breakup is going too far for you. And I do mean even thinking about it, even if you would never do it, but you find yourself thinking, about anything along those lines, which I actually do sometimes, get people in my office that express that they know they would never do it, but something like that kind of crossed their mind and it was alarming to them, and so they decided to come in and talk to someone. And I've certainly had people come in over breakups. So I feel like if you're even going into that place, I would definitely go ahead and get some support, because the way the question is phrased, how do you know the difference between real problematic anxiety and depression? Well, let's be honest. Real problematic anxiety and depression is actually something a lot of people do experience, and getting a little bit of therapy or some support during a breakup because you are experiencing some intense symptoms is actually okay. So I would actually, in a way, encourage the person to not worry too much about, trying to decide if it's clinical or not, and more just ask themselves if they feel like they would like some support. And if the answer is yes, then I would just encourage them to at least try a therapy session and see if
Hey, Chloe, sorry, I think your audio cut out. Can you hear me okay?
Yeah, I hear you fine. Do you hear me?
I can hear you now. It just cut out for a little bit.
Okay.
Perfect. That's some really good advice, I just want to say, because a lot of people after they break up, they do feel really strongly and they've hurt a lot. And a lot of people will just say, go out, get over it. There's a 1 in a million, right? He's another fish in the sea. So I really thank you for letting everyone know that it's okay to be hurt. It's okay to go see a therapist.
Absolutely. Happy to help.